Let's talk about Babble Boot Camp, or as we call it, BBC. What is Babble Boot Camp? It's an intervention for infants and children that has been tested through a large National Institute of Health funded clinical trial. BBC is designed for babies and toddlers, ages 2 to 24 months, who have a known risk for speech and language disorders. Some of the unique features of BBC is that it's proactive, meaning we treat the child before a disorder is apparent. It's longitudinal. We follow that child for at least 2 years. It's systematic. We've bundled together evidence-based routines and activities targeting specific behaviors and skills. Hopefully throughout the training you will find yourself saying, "I know that," or "That's what I do in my clinical practice." We, the authors of BBC, have not invented new treatment strategies. Rather, we have bundled multiple evidence-based treatments into a systematic intervention that is quite common sense and encourages great parenting skills. Let's talk about some of the early BBC research results. These were published in several papers by Peter et al., all in peer-reviewed journals. The children with classic galactosemia receiving BBC intervention at 10 months of age had more sophisticated babble skills compared to children with classic galactosemia receiving conventional care. We also surprisingly found that at 10 months of age, the children with CG receiving BBC intervention out-babbled their typically developing peers. And at follow-up, which is ages 2 and 3, the children with CG had higher articulation and expressive language scores compared to their peers with CG receiving conventional care.
Here we have another video. Let's watch it.
I love that smile. I love your smile so much. Is that right? Is that right? Oh my goodness. Oh my goodness.
All right, let's watch this again and see what amazing things we can notice.
I love that smile. I love your smile so much. Is that right? Is that right? Oh my goodness. Oh my goodness.
Okay, take your turn. Nancy, Claire, what do you guys think?
One thing I noticed is that this baby is varying her loudness in her vocalizations, and sometimes they're a little bit lower and sometimes there's more power behind them.
She's also starting to make some more syllable-like shapes, where she has a syllable onset and a syllable offset, although they're not yet word approximations. She's getting the idea that conversation has words that actually have a start and a stop to them.
Those are great observations. So what we do see is some more syllable-like vocalizations coming. That loudness is changing depending on what she's trying to maybe express emotionally. Those back sounds that we noticed earlier in the module, they're becoming more developed and defined. And finally, there's some turn-taking that's happening. They're going back and forth, the daughter and the dad. It's really exciting to see. Now let's take a look at one of our first planning questions for the babbling component. Let's watch the video.
Yeah. Yeah. You want to tell me about it? Are you hungry? Yeah.
So if we can remember, we can see her doing some basic babbling. She's changing her pitch and volume, has that consonant that M sound. She's taking turns with her parent and creating a lot of direct eye contact. So based on what we've learned, now time to develop a plan. Let's watch the video one more time and think about what could be next for this baby.
Yeah. Yeah. You want to tell me about it? Are you hungry? Yeah.
All right, go ahead and take some time to think about what could be next. Nancy, Claire, what do you think?
Well, I think you could repeat what she's doing and talk about and come back with saying the same thing to her, maybe babbling back to her, maybe putting some of those sounds into a word.
Yeah, I thought the same thing. I thought she could imitate the sounds back to her baby, and also modeling other sounds for that baby and introduce more complexity to her babble.
Yeah, those are both great ideas. So, like you said, continuing to imitate, expanding on the use of her pitch and volume, create more conversation-like discussions in their babbles. Additionally, she has some basic sounds that she's using here. Maybe starting to use those and try to create meaningful utterances, such as mama. She has those sounds already, so let's see if she can use those as a word. And finally, providing and modeling some other nasal or labial sounds to introduce her to more sounds to use, gaining more complexity in her babbling, maybe introducing the next stage, variegated babbling, changing how she's saying consonants or vowels to create more complexity.
Now let's watch Jenny Davis, our Babble Boot Camp SLP, coach a parent on labeling.
Now you're down, up, down, up, down, down. Penelope went up, up. So is she making a whole variety of sounds that you're hearing from her?
Yeah, she's a talker.
Good. Yeah, you mentioned that last week too, babbling a lot, lots of variety, lots of gestures. Ba, 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 ba.
Two things she's doing, like we imitate sounds for the baby. Like when we feed the baby, we'll go glub 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 glub. She starts doing the same thing. She'll imitate for the baby when she's feeding the baby. So she'll go glub 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 glub, or like she'll to her mouth and she'll make noises for the cup, like a cup noise, like cup 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 cup. Yeah.
Okay, good.
It's not exactly like our noise, but she'll make a slurping noise.
Okay, and she'll do that she'll do that just on her own when she's playing and she feeds the baby.
Yeah, we do it. Just we're pretending. We pretend with the baby and with the cup. Not intending for her to do it, but all of a sudden she's starting to do that. Okay, good.
Yeah, she's paying attention. Good. So that would be, if she does it right after you do, then she's imitating. That would be direct imitation of what you just did. You do it, and then she does it. You do it, and then she does it. Now, if she does that with you, but then she also goes over just on her own and picks up the baby and makes those sounds when she's playing with the baby, she's doing that. We would call that spontaneous. She's not, she's imitating in that she learned it from you, but she's figured out how to use it. So she's not having to imitate anymore. She knows what to do and she's doing it on her own, doing it independently. And that's a really big step. That's really good.
Modeling is the fifth component of the BBC communication components. As a reminder, our teaching model includes 5 steps: review, coach, teach and model, plan, and questions. Let's talk about what is the role of modeling. Modeling is labeling with the expectation for a response from the child. Our previous module, labeling, did not require a response from the child. That's the difference between modeling and labeling.
Let's watch another video.
Apple. 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 Okay, you ready? Boat. Cat. Dolphin. Dolphin. Elephant. Elephant.
All right. right, watch it again and think about the amazing things baby and caregiver are doing.
Apple. 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 Okay, you ready? Boat. Cat. Dolphin. Dolphin. Elephant. Elephant.
Claire, Nancy, what do you think?
I think the parent was giving a really good model of the words for the shown image, and then she was pausing and waiting for the child's response. And the child was so engaged, even though there was commotion in the background. She stayed with listening to the model and repeating it.
Yeah, you said that very well. And you could tell she was really engaged in this activity of labeling the images, and having that visual and verbal model will help build the schema in her brain.
Awesome. Those are great examples of the amazing things you can see this family doing. So again, the caregiver is modeling the words of a shown image. So she's seeing that picture, but also hearing the words and then responding to that. Her mom is also pausing after each model, so it gives time and space for her daughter to respond. But when she doesn't respond, she repeats the model and waits again, which is excellent. And finally, we can really see this child focusing and interacting with the materials. She is ready for the next one. She's really engaged, and she's really engaged in hearing what her mom has to say and then replying to her and saying that thing that was just modeled. All right, let's do a planning question. Let's watch the video.
Apple. 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 Okay, you ready? Boat. Cat. Dolphin. Dolphin. Elephant. Elephant.
Okay, just like we just discussed earlier in this module, we can see her mom modeling the words of the pictures, pausing after each model, waiting for her daughter to respond, and then when she doesn't respond, repeating that model. And then finally, again, this child, she's really focused on the materials and responding to her mom. So let's watch it again, and this time think about what could be next for this family.
Apple. 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 Okay, you ready? Boat. Cat. Dolphin. Dolphin. Elephant. Elephant.
All right, create a plan. Okay, Nancy, Claire, what do you think?
I'm thinking this child is ready for more words. So when she's, doing elephant and she's starting to get those 2 syllables, or at least marking 2 syllables with her word approximation, you could say an elephant is big, or the big elephant, or the gray elephant, or the funny elephant. So adding some adjectives in would be a good next step.
I think that's a great idea as well, Nancy. And I think also continuing her pausing and waiting for the child's response is a great thing that the mom is doing, and we should reinforce that and have her continue to do that.